Hi, I'm Dr. Joyce Knieff with Yggdrasil Naturopathic Medicine, and today we're going to talk more about autoimmune disease. This is part 4 of if I were seeing a patient with an autoimmune disease, how I would approach it from a functional root cause perspective to make sure that they get their condition under control and can start living their life again. So previously we talked a bit about how to get an autoimmune disease out of a flare. We talked about the impact of gut health on autoimmune disease. And then we talked about the hormones cortisol. And then we talked about the impact of stress in the form of cortisol on autoimmune disease. Today I'll talk a bit about the other hormones, in particular the sex hormones, and their impact on autoimmune disease. We know that by and far, most autoimmune disease sufferers are women, and this is because estrogen and progesterone do have a huge impact on autoimmune disease. So, unfortunately, we do not know the specifics because estrogen and progesterone are such complex hormones when they interact with the body, but we do know that within the 4 stages of a female body person moving through their life, that they can have manifestations or exacerbations or even improvements in their autoimmune disease depending on which stage they're going through. And these stages are being prepubescent, going through puberty, pregnancy, and then going through menopause. So all of these stages can have a different impact on autoimmune disease because of the change in hormones that happen through these stages. So the role of progesterone and testosterone in autoimmune disease tends to be a little bit more straightforward. A lot of research has pointed to these hormones more as anti-inflammatory hormones to the immune system. The one that can get really complex is estrogen. So estrogen, there's been a ton of studies done on estrogen, and it can go in different directions. So estrogen as a hormone is known more to be a proliferative hormone. It causes cell differentiation and proliferation, so it makes more cells. And it's also stimulating to the immune system in a very specific way. So previously, I've also talked about how the immune system generally has 2 branches. One is the Th1 branch and one is the Th2 branch. What estrogen does is it promotes the Th2 branch. So in phases of life when people have high estrogen or if they go on hormone replacement therapy, a lot of autoimmune diseases that are imbalances with Th1 can get better, whereas autoimmune diseases that are ruled by Th2 imbalances can get worse. So this is very different and very specific to each particular type of autoimmune disease. There's a lot of interplay that goes on between autoimmune disease, inflammation, and where your hormones are going. And in the medical landscape right now, this is particularly important because a lot of people are going into menopause and wondering whether or not they should do hormone replacement therapy. This can be a multifaceted decision. Currently, there's a lot of research out there showing that in terms of more population long-term health related to bone density, cardiovascular health, and brain function, perhaps going on estrogen replacement is the better option. But with people with autoimmune diseases that may get worse with estrogen, this can be a more individualized decision. If you are looking for individualized care that takes into account everything that is going on in your body, this is the type of medicine that we practice at Yggdrasil Naturopathic Medicine. We are located in Minnetonka, Minnesota, and we do offer free consultations just so that you can get a chance to share your individual story with our doctors. Every individual is different, so our approach to medicine with each individual is different. There might be certain trends that may seem similar, like the way that I'm making the series of videos on autoimmune disease and kind of what things I would look out for. But everybody, at the end of the day, has a different picture with how their physiology interacts. If you're interested in getting individualized care specific to your condition, that's the care that we provide. We offer free consultations with our doctors. You can come in and have a chat, give us a phone call, and we can see whether or not we're a good fit.